So good afternoon, everyone that is arriving already to the seminar. We are about to start. We're waiting 1 or 2 minutes for everyone to be ready. Before we start, just a reminder to everyone that if you have a question, please write it in the chat. I'll read it for you, but if you want to read it yourself, just let me know in the chat, so I will give you the word. Together with me is Christian. He's on site. He's there in the camera, as you can see him, and you know him. And also there's going to be the presenter that is there and a couple of people, I don't know how many, that are attending. We are going to keep on having these seminars in a hybrid way. So we'll have some people there and some people here online. It's 1 and 2 p.m. So it's already getting late, Swiss standards. So we are going to start with the seminar. And it's really an honor to be able to introduce the speaker of today. I would like to introduce him. He is a professor, a fantastic professor that works in the best institute in the world. So it's great to have you here, Thomas. No, seriously, I don't think Thomas requires introduction, but I can tell you that he has been working many years and he has been a role model for many public health scientists working on very important areas as inequalities and health behaviors that I think are a top priority that we are not paying enough attention to. Thomas, it's really an honor to be able to have you today with us in this seminar and to listen to you talk about health literacy, which I think has become every time more important, specifically and especially during these difficult times that we are all living. So Thomas, thanks a lot. I won't talk more and the word is yours.
Okay, then I start. Thank you, Oscar, so much for very kind words. Thank you, Christian, for hosting this. Thank you all for coming to this room. And of course, thanks everybody out there who tuned in this afternoon for this session. I like to start with a kind of a bold statement. I think there needs to be more thinking, and we need to trust the people that the people can actually have the capacity to think. Reasoned-based thinking is needed. For example, when unreasonable news about the causes of the SARS-CoV-2 virus are spreading in social media, it is needed when presidents of large countries bubble something about intensive light as a cure for COVID-19. I think it is needed even with more trustworthy governments when they revise information on protective measures weekly. Critical thinking is needed. And not just fake news requires the people to think and reflect. It's also charts like this that was published from the Texas Medical Association some weeks ago, and they ranked the risk of contracting the virus. And they come up with things like low risk is going camping, and the highest risk listed here is going to a bar. And that makes me think of a campground when it gets cold at night, even starts raining, and people gather in tents, bring their drinks and having a good time. And it makes me think about a bar where hardly nobody is in there, and one would go and have a coffee or a drink. I mean, classifications like this might really be misleading. Perhaps they should not be published at all. But they will be published. This type of information will be around, and we might as well think about improving individuals' critical health literacy to deal with it. Now, this is what I've prepared for today. So first, I will give a very short social perspective of the social problems that can be identified in this crisis. We had last Last seminar, we had Claudine Jean-Claude Burton, and she gave a wonderful overview of the psychosocial consequences. So I can be very short on this. And then I will try to introduce the concept of CHLP, we call it, critical health literacy in a pandemic. And that will take about 15 to 20 minutes, and we can have questions at that point, because the second part of my presentation is very different. It's sharing our experiences with trying to measure the complexities involved in this approach. When we use a critical health literacy approach, it's very, very difficult. But we are trying to measure, and I want to share this with you as well. And then finally, there will be a very short summary in key points and some outlooks, ways forward in research and in practice. And hopefully, of course, we can have some discussion later on. Now, the social problems are huge, and I don't have to list them all, or I don't have to produce a list here. But what we can clearly say, the social problems affect the individuals and they affect societies. All the levels are affected. Individuals suffering, and societies, whole societies get divided in this crisis. And it's unfortunately often politically misused to divide societies. This is a huge social challenge. The consequences are dramatic. It affects millions of individuals. It affects countries, global markets, in fact, the world society. Because when we think about solidarity, what will happen when we have a vaccination available? I mean, what about our world society? These are enormous, enormous social issues. Now, while the people feel in their everyday life the social, the consequences, the factors, the processes, it seems to me that among the leaders, there's less attention on the social. First comes the focus on medical solutions, then comes the issues on economy, and then we slowly start considering really the social causes of the problems, the social solutions. But I think we need social solutions. Probably most apparent for everybody when we talk about the behavioral patterns in the populations. We need social solutions for this. There's no medical solution, there's no economic solution. We need social solutions. And then health literacy, in this focus on the social, health literacy has been suggested a helpful approach. Now here's something that was just published from our public health, from our colleagues' public health agency in Portugal, where they consider health literacy as the most effective approach at the time, right now, which I think might be a little overstated. And still, I think there is something that we should look closer to, so we can find out what is the real potential of a health literacy approach, a critical health literacy approach. Now, what is health literacy? As Oscar said, it's becoming more and more popular long before the current crisis. It comes from health promotion and disease prevention. And here's a definition that Christine Sørensen and her colleagues have offered. And that brings together the basics. This is about people's knowledge, motivation, and competencies. It's about access to understanding, appraise, and apply health information. And what their definition also provides is they distinguish 3 different fields of application. So health literacy can be applied in healthcare, in disease prevention, and in health promotion. Now, if this is health literacy, and this is the most cited definition, definitely in Europe, in the European context, if this is health literacy, then what is critical health literacy? Natbeam has introduced this idea of critical health literacy, and he talks about more advanced cognitive skills and critically analyze the information. So that was in the year 2000, and this was first started to talk about critical health literacy. And then Susie Sykes produced this definition that I still find very helpful these days, that it's about citizens. Citizens become aware of issues, they participate in critical dialogue, they become involved in decision-making of health. It's an ideal, but I think it is really a nice framing of the concept. So critical health literacy is about understanding the economic, social, and environmental determinants. It is about participation and involvement, and the sociological concepts that can help us to understand these factors and processes. They are around agency theory, they are social practice theory, empowerment, and also theories around individual and collective responsibility. Now, I think that now we can move to this idea of CHLP, critical health literacy in a pandemic. These so far had nothing to do with the pandemic. It was long before this was an issue. But I think now we can move towards that. And when we look at the current crisis, there are three key features, I think, quite obvious. This is the urgency of public health action. There's urgency here. There's the complexity of the consequences of these actions, also the political actions. And at the same time, all this is based on uncertainty of scientific knowledge. And I want to take a few minutes to look at each of those. Uncertainty of scientific knowledge. The scientific knowledge we need to deal with this crisis is only emerging. And the knowledge production needs time and it needs money. That's a key feature. But at the same time, there's poor communication about the limited knowledge, about the knowledge of the things that we really feel confident with, that we know, the things we know, and there are the things we are not really not confident, and there are things we simply don't know. The communication about that is poor. And sorry to say, it's also poor among the scientists, but definitely also among the politicians. So the politicians use the scientific knowledge and they reproduce it in poor ways. And the third problem that I think is worth considering is our populations are not prepared for this. In public health, we tend to tell the people, here's what we know. We know what you should do, and this will solve the problem, or this will do you good. This is the usual health message. And now we have limited knowledge. How do we communicate that? We have hardly any standard models to communicate uncertainty. And that is a problem. The consequences are clear, or at least here are some of them: inconsistent population behavior, lack of trust, which is in some countries by now a major problem. So undermining the trust in, let's say, the CDC in the US is a big problem. And there's stress on the individual. And here's just this quote from one of the many now published papers on the link between uncertainty, anxiety, and depression. The second point I mentioned was the high complexity of action. So the preventive measures that we are offering, they are multi-level and multifactorial. Often we we present them in a bundle of measures, and then we say this will help. And we are confident this will help. But we cannot exactly say which of these measures will exactly contribute what amount of success to the story. So, and that's normal. And that's part of the complexity. And if we take action, these actions are complex and the outcomes are also complex and difficult to describe. The complex conditions also for political action. There's political action taken and they really cannot exactly say where this will lead to exactly. That's because of the complexity. Individuals are challenged with complexity as well. There's this huge issue of individual responsibility and collective responsibility. This is extremely complex. And how individuals solve this for themselves, for their family, for their neighborhood, that's the huge issue. The consequences are a high degree of unpredictability. The consequence is there are no simple, straightforward solutions because it is extremely complex and we cannot predict it completely. And it is very challenging to send messages to the population with this complexity in the back. And finally, the urgency of measures. This is, I mean, so obvious. We need immediate public health actions, but under conditions of uncertainty. We need to build expert collaborations. And I mean, who knows this better than Christian, for example, how difficult this is to bring the experts together. And again, unfortunately, these things need time. They need time to find the grounds to talk to each other and come up with the best common solution or shared solutions. And the measure of and the urgency is a big problem when we are working with the populations. So if we have no sufficient models working with the populations under these conditions, and that is a problem. The consequences are ambiguity in public health approaches, lack of collaboration, including that with the public. Now, these three major features that I outlined, as if this wasn't enough, in fact, there's more that makes it so difficult. And I identified three of those. This crisis, the overcoming of the crisis, like hardly any other health crisis, it needs the active participation of the public. Often we find solutions basically where the public needs to be more or less moderately involved. Here we depend, the success depends on the public. There are many obstructions that come from poor policies, from the problem of too much information to too poor information, infodemics. We have media failure, I call it really media failure, and political propaganda. They all can undermine the public health measures. And there's another challenge that comes on top or makes these three so difficult, is while we look for generalizing solutions for the whole population, it is often that the exact conditions in which people live do not fit that message. And people, that's also, we need people to think. We need the people to adjust these recommendations to their real social living conditions. So we cannot afford to overlook the people. They are crucial in them. The message can, most of the messages cannot be generalized. Only a few. Wash your hands, keep the distance. These can be generalized. But how to do this is so different for the people. So people need the competence to do this. Now we can now link critical health literacy in pandemics to these issues. And to make it short, in all three issues, what is needed is awareness. People need to be aware of the urgency, a critical understanding of the issue to a certain degree, and reflecting, because complexity, there's no other way than reflecting about these issues. In all three of them, this is needed. And what is fundamental, for the moment, I called constructive understanding. It requires critical thinking simply because the given uncertainties and the complexities need an understanding, but it has to be constructive in the sense. So destructive would be interpretations like we see among many of these protesters. That's a destructive understanding and dealing with the issues. We need a constructive way that people think about this. Now, we are very close to a definition of critical health literacy in a pandemic. A concept like this, what we call CHLP, needs to include the awareness of the population of the pitfalls of the information, the skills to critically assess the information, understanding and balancing individual and collective consequences of their behaviors and their responsibilities, the skills to work with the best public health advice while accepting the uncertainties in the scientific knowledge. And with this, we dare to present a new definition of CHLP, that it is about the competences needed in a pandemic to understand and effectively respond to the urgency of the action at all levels, the complexity involved in the causes and the consequences, and the changes in the scientific basis over time. Now, if we were for a moment to accept this definition, then this would, and if we would work as public health experts, health promoters, and public health would work with this definition, it would strengthen the individual's abilities to understand, to reflect the contextual conditions, to carry out appropriate action, strengthen the agency of the individuals, and thus contributes to a more comprehensive and societal response to this pandemic. And those occurring in the future, because it's worth making progress here, because even if this pandemic will be over, most likely there will be more. So this definition is new in the sense that it departs from older definitions of critical health literacy, and that it incorporates specifically the pandemic issues. And I have prepared a slide. If in the discussion this is of interest, we can come back to this. So this is the introduction of the concept and the theory behind it. Before we jump into empirical issues, data, measurement, there's time for questions if there are any at this point.
Thanks, Thomas, for this first part of the presentation. I don't see yet any questions in the chat for Oscar, so maybe we start here.
I do have a question, Christian.
Yes, are there any questions? No, if not, maybe I have one that maybe you tackle this in the second part of your presentation, but I was wondering a bit whether you've looked at critical health literacy during pandemics and country comparison, for example, Europe versus Asia, and whether basically the history of a country really helps. So as you just said at the end, that in the future we might be better prepared, whether a critical aspect of developing this health literacy is basically previous experience with such an event.
Yeah, I would say a super interesting issue, and theory could help, for example, when it comes to the meaning and understanding of responsibility. Collective responsibility might be very different in some Asian cultures compared to Westernized, very individualized. But I'm not aware yet of analysis of these, so direct comparison. But I know that there are many studies underway. They are still collecting data, and I'm sure this will come up, but not yet. We are lacking behind, as I said at the beginning, unfortunately.
It'll be very interesting to see that there is one question online, and maybe we can go back to you. So I switch to Oscar.
Christian, I will appreciate if you and everyone there comes closer to the microphone and speaks louder so that everyone online can hear you. We have a question here from Cristina Martinez from the Ligue Suisse Contre le Cancer. She says, thank you so much for emphasizing the how to do something for individuals. My question, a structural level and dialogue are so critical. How could leaders or scientists pay more attention to health literacy? Thank you.
Yeah, excellent input here. Yes, there is this tendency to use the health literacy approach a bit biased and individualized. At the same time, as soon as we have identified these types, for example, the next question has to be, how do the structural conditions promote the health literacy that we need? And how do the systems incorporate health literacy in the overall functioning of the system? So there is then the link definitely to the structural conditions. There's another one that is, for example, as I tried to indicate, is that social inequality is inherent. And the critical health literacy would raise awareness for the social inequality in these health issues. Another link to the structural issues. But we can talk about this more later if you like.
So I come a bit closer. There was one other question here from the audience. Maybe just speak loudly.
Yeah, but actually my question was related to the other Christina's question. And it was like, I think there are some other factors that are also attached to critical health literacy, and were those structural issues you just talked about. But I was wondering if maybe in people who don't have that structural issues, is it possible that there's still some health literacy or lack of health literacy coming from willingness of ignoring the data, or like just putting in first place their own interests, and I mean having the ability of critically thinking, but just trying to ignore it for their own sake? Is that like, have you read about it, or would you just assume that someone who's well educated, that has good conditions, social conditions, will therefore be health literate?
Yeah, okay. I would definitely not assume this. So social class and high or low health literacy, that's not an easy link. Only if you would measure the typical middle and upper class attitudes and knowledge bases, but if it comes, and we will see this later, I will show data from the most highly educated young people in Switzerland that have low awareness. So the links are really quite complex, and lots of opportunities to do good research.
Thanks. So I'd like to give over to Oscar. I think there are a couple of questions online.
Thank you, Christian. We have a couple of questions. We'll start. The first person that came forward was Joe 20682. Please change or put the proper name that I can read. And then I will give the word to Matthias Egger that has a question as well. And then we have like three more. Is the COVID-19, this is from Joe 200602, is the COVID-19 spread in school and unis at its higher rates? If so, is going to be a way of including the awareness in the school's curriculums, or what way do you think is a better way to cope with this? So should it be included in the curriculums, or how to deal with the students and that, basically?
Hey, Joe, you just ruined my presentation, because that is my last slide when I talk about schools. So can we postpone this until then? Thank you.
Thanks, Joe. Matthias, you want to say your question?
Yeah, can you hear me?
Perfectly.
Okay.
Very well.
So thanks, Thomas, for a fantastic talk. What puzzled me a bit is at the beginning you said, you sort of stressed we need social solutions, not economic and medical solutions. Could you expand a bit on that sort of separation, categorization of solutions across these three categories? I mean, I personally think that the economic measures taken by the Swiss government, which cost billions to keep people in their jobs, was probably the single most important intervention to prevent what we could read on your slides, the adverse effects of unemployment, etc. And would you see this as a social intervention? I would probably say this is an economic intervention. So over to you. You get my point.
Yeah. By the way, I couldn't agree more that these macro level structural interventions, like in the labor market, they are also there to prevent social problems and even suffering. I totally agree. What I was thinking about more is like, let's say, social isolation in the neighborhood. That has become a problem. And just this morning in the news, there was something on elderly people really suffering from social isolation. And what economic or medical solutions could we have on that? Very little. Of course, I think of a biopsychosocial understanding and general approach that we need, but I also think there are some issues that are inherently and primarily social, and that needs good social research that we still wait for, and good social solutions. So it's more in that sense, but I can see many issues where the medical, the economical, and the social come together.
Thank you, Thomas. Christian, I have more questions here, but first let's go through the public there.
Are there any questions here? No, I think then we can go back online.
Thomas, do we still have time for questions? How much time do you want to dedicate to this part?
How about one more question? And then, because there will be a question and answer and discussion session at the end anyway.
Thank you. Then I'll forward the question of Christine Sorensen. She says, in Taiwan, they integrated health literacy as part of the preparedness. How can we do the same in Europe, especially CHL, critical health literacy?
How come we do not? Or
yeah, but I guess it's both aspects. Why don't we do it, and how come we do it?
Yeah, excellent question. I think that, as Christian indicated with his question, there are cultural and historical, and political differences. I find it extremely hard in a context in most Western European countries to talk about critical health literacy, as if critical was something bad, when in fact constructive criticism is needed. So that is perhaps one part of the problem. But given the current crisis, where we understand that infodemics, for example, that in conditions where we can no longer rely on politicians to tell something that is helpful, I think critical health literacy will also see a rising importance even in our countries.
Thanks, Thomas.
Okay, with that, I think we continue, and at the end we have more time for questions. So over to you.
Okay, thank you. So this is very different now. This is about first empirical attempt, I would call it. There was a great window of opportunity when in April we were approached by Belgian colleagues from the University of Antwerp who said we want to do a study among university students and how the current crisis affects their well-being. And they included measures of depression and anxiety, risk behaviors, and they included measures on, are these things changing during the crisis? And that was a great opportunity to participate in this international study, which then grew and grew. They started out with 5 countries. In the end, it was 27. In the end, it was more than 100,000 online survey interviews. And we had the chance to add a module, at least for the Swiss and 4 German universities, a module on critical health literacy. Because we were thinking about this. And then this window of opportunity opened, we could collect data. And we didn't have to wait for for grant money coming in. It was basically all, you know, with your shoestring budgets, you could do this. So that was great. So we had 4 Swiss universities participating, University of Bern, Geneva, and Fribourg. And we had the University of Applied Science here in Bern as well. And overall, we had about 3,600 interviews. And so this was a great chance. So what I can share with you today is just the first steps, how if we have theoretically identified these issues of complexity, for example, as so important, can we measure that? So this is what we tried. We had space for 5 items. And I would like really you to go with me through these, because we put so much thinking in it, and we know it's not perfect, but I think these are good examples of how complex something like this is. So we asked these students, how would you rate the current scientific knowledge about COVID-19 available to guide political decision in Switzerland? So this is about awareness of how good this knowledge can be. Then the next question, indicate, do you agree or disagree that actually in this crisis, the decisions are simple and we can do straightforward approaches? As you can see, this is complexity, right? Do they understand the complexity? Do they understand that this is not simple? The different interests and motivations, even vested interests that all of us, we see every day, right? When politicians make decisions to either open this type of businesses, but keep others closed, we know that this cannot be purely based on evidence from epidemiology, for example. There are other interests coming in. Making the whole thing extremely complex. Are the students aware of this, and are they interested in it? There was, at that time, the Swiss data were collected in May. So there was this, that it's only people 65 plus that are at high risk and so on. And so we asked them, do you think that consequently only the behavioral restrictions should only apply to these people? So this is about knowing and about awareness of, again, that this is way more complex. And finally, the last question was, do you think that this virus affects everybody equally, independent of social class? So these were the questions we came up with. And I'd like to show you a few of the results that the first results that we have available. This is the question on individuals are affected equally, independent of social class. So you can see that most people disagree with this, which is good because it's not true. Not everybody is affected equally. It depends on the social class. So this is good, no? But then we see this. Depending on these students, these are all university students, highly educated. But when we look at their parent socioeconomic status, we find a social gradient. So those who have come from a lower class background, they are more likely to agree. And this is a gradient effect. So with every class, it rises or it decreases. And I think it's, isn't it a kind of a paradox? Because it is those in the lower social classes, coming from the lower social classes, that say, oh no, it has nothing to do with class. I find this an interesting result. It's preliminary, but there are sociological theories that could explain this. Because once you are in a deprived position, you better close your eyes, you don't look at it. It's a bit like this. So, but I think this is what these type of data can do. They can offer a question. Shouldn't we go deeper into this? That's just an example. Then we created a sum score using 3 items to measure awareness. Because, you know, with statistics, we like sum scores, we like other forms, not single items. So we have that. But that's not easy. Although this looks like a scale, when you look at the question, it's actually tricky. So what indicates low awareness on a scale like this? We discussed this heavily. It was great discussion with a wonderful team of young, fresh minds. And we think that these were both wrong. I mean, at that time in May, the knowledge was not very strong, but it was not very weak. The knowledge was good enough to offer some recommendation, but it was definitely not very strong. So these are now indicating, these 2 answer categories indicating low awareness. And we did this for the other 2 items as well and created a sum score. Now, this is the distribution, a very simple distribution of the sum score. And you may think, oh, great. I mean, there's high awareness among these students, and the group that is really poorly aware is small. I'm not sure. This is our elite. This is the highest educated that we have in Switzerland. And we see that about 6% have extremely poor awareness. And the awareness that we want to see, it's less than 60%. So I'm not sure if this is good news. I think there's something. I think we need to look at this more closely and eventually do something about it. Now I can skip this for the moment because I took some more time. This is interesting. So we have a student population, and there are some specific characteristics that in the first analysis we looked at. the difference between bachelor, master, and PhD. This clearly indicates that we are still with the sum score of awareness. This clearly indicates that those who are into research, the PhDs, they have a significantly higher awareness. They have better scores. They are aware of complexities. They are aware of the more differentiated issues involved. And when you look at the university type, that's also interesting. So university compared to the University of Applied Science, so those who are more into practice and those who are on average more into research, that kind of confirms this one, that there's higher awareness among university students compared to those at the Universities of Applied Science. So this could lead to a hypothesis that in fact, awareness comes with research. And perhaps we can look at this more closely. I think we should. Now, I think I can summarize and look for ways forward. Ways forward in research. I think a sound and more sound theoretical basis needs to be developed for critical health literacy in pandemics, CHLP. A good theory can help us to define, in fact, the range of themes. What themes should we approach? I have suggested 3 major themes in the first part of my presentation. There may be others. We should come from theory to define this. It would also help us to look at what type of measures do we need and what kind of analysis should we run. Because should it be kind of dependency? What do we think how the relations look like? That will help us also in the empirical part. In the operationalization, these are tiny first steps that we need. We have 5 items in a very new field. To my best of knowledge, nobody has looked at critical health literacy in that sense, addressing uncertainty, complexity. This is Neuland, new grounds. And so these are very first steps. It needs much more, but to come. We need methods, other methods, qualitative methods need to be included, no doubt. In the end, the best will be mixed methods that we need. And the data analysis, we can come up with really sophisticated multi-level modeling, for example, or interaction regression modeling. These are the things that we strive for as soon as we are in the next stage. Now, practice implications. I would like to distinguish between practice at the micro level, meso level, macro level. Here's an example for the micro level, again from our colleagues in Portugal. They suggest to use micro influencers in communities. I thought that's great. I'm too old for this, but so I'm not an expert in social media. I have no personal experience with bubbles, or at least not social media bubbles and so on. But it looks, every once in a while I hear something about influencers. And I think, oh, that's interesting, millions of followers. Ooh. Well, maybe there is something that we can use to promote a more critical thinking about a health threat like this one. At the meso level, and here is what one of the participants mentioned, the school setting, but there are other settings. I would really recommend on the meso level, the setting approach, families, workplaces, social groups, and schools have been found by our colleagues in Finland, Leena Pakari, who looked at how schools can help students to learn critical thinking, reflecting on issues, and why not on health issues. I think this is really a great chance at the meso level. And of course, at the macro level, the role of governments and other macro representatives of the macro structures. Well, do governments communicate complex issues really in the best way to the public? In what way that addresses the citizens as people who have to take decisions? I miss this. It comes across always like, we know what you should do and that's it. How about, we know that this might help you adjust this to your current living situation. So are our schools as social institutions, are they ready to include critical health literacy in their curricula? What is the role of public media? And here I like to think about the serious media like good old SRF, BBC or PBS. I mean, what can they do to improve the health literacy that is needed in times of uncertainty? Can they also address uncertainty? Actually, I have listened to one on SRF 3 that was meant for the young people. It's 7:45 every night. And they addressed it. They said, yes, we really, and the scientists, there are these things that they don't know. But what the hell? I mean, they know this one and we should go with this one. Can't we do this, integrate this for adults as well? Shouldn't that be part of the communication? And then, of course, the role of us as public health researchers. I think that we should also critically look at ourselves, what we are doing. Are we prepared and equipped to produce the kind of biopsychosocial knowledge that can guide interventions on all levels? Are we really good in all three of these? And do we understand and adequately address the role of the active individual? We said we need the active individual. And do we really address them as such, or do we address them as receivers of our messages? Now, summary in 6 key points. The conditions that I described in the last 45 minutes, the key challenges are clear: urgency, complexity, and uncertainty. Successfully dealing with it needs the active participation of the people. And many factors obstruct our attempts to solve the situation. Poor policies, infodemics, media failure, and propaganda are really making the life for public health interventions difficult. The concept of CHLP that we are offering here, we have identified individual competence is needed, and we called it and defined it as critical health literacy in pandemics. I think that public health and health promotion experts might work with this concept, and through this concept facilitate strengthening and utilizing individual and collective agency. I think a lot has been done in the public in this crisis that doesn't get enough attention, but we can talk about this in the discussion. And this would then prepare us as societies better for get out of this and prepare better for those pandemics that are unfortunately clear to come. And of course, the final step, this concept of CHLP awaits further theoretical and empirical advancements, no doubt about that. Thank you for your attention. Thank you all.
Thanks, Thomas. I give over to Oscar and other questions online.
Christian, we do have a pending question from Joe, which was about whether it should be included in the curriculum of the students, and Thomas promised to answer that question at the end. So let's start with Joe, and then we come back to you, Christian.
Here's my answer. I think if we use the setting approach, yes, the schools are the ones that have a prominent role to play for many reasons. But I'm aware of the reluctance in schools. I mean, it's all the social problems, we dump them on schools, right? And then the teachers say, now we are here to solve your problems. It is difficult. Given the stress that that these comparative studies, like what is the one, this compares the school performances in Europe. Well, anyway, put so much pressure on schools that mathematical skills and all these skills need to improve. Well, I would say health understanding needs to be improved. We see it now. So I think that it has a good chance to be effective if we can include this in schools.
Is there a question here from the room?
I do have a question. How did you measure parents' socioeconomic status? Because I was thinking that maybe in the last seminar, the professor from Geneva was saying that people who have higher income not necessarily have higher education.
Yeah, I was afraid somebody would ask this. The thing is that we measured it, and it's a good measure. We measured it by educational degree of the parents, which in this context makes a lot of sense. Awareness, understanding, and so on, maybe more important than money in the family. And we have evidence for this. But you are absolutely right. See, a good PhD student, you are absolutely right. We should perhaps say this is educational status of the parents. Yeah.
Was this kind of question developed in Switzerland also distributed among the other countries in the world, or it was just for Switzerland?
These 5 items, these 5 questions, were applied in 4 Swiss universities, plus 4 German universities, but not in the others. We also included some measures that we can test the reliability and validity of it. That was included only in Switzerland. The German people said, well, you do the reliability tests, then we know. We don't have to use these. But the 5 questions only in Germany and in Switzerland.
Any other questions online, Oscar?
Yes, Christy, to our colleagues in the other, a little bit louder, otherwise we can. We have a question from Susie Sykes. She says, given what has been said about the importance of both individual and collective responsibility in the context of pandemic, is this an opportunity to think more carefully about how we understand and develop CHL at the community as well as at an individual level?
So, with respect in particular to responsibility, I think it is a key issue, this responsibility. And I would say as in the social sciences, there should be a discussion about the distinction anyway between individual and collective responsibility. They are so closely intertwined. I think it would be a great topic for further research and very, very closely linked to critical health literacy. But I'm not aware of any current works that addresses this individual collective responsibility linked to critical health literacy, definitely not in pandemics. But Susie, you may know this better. There may be this research going on. In terms of pandemics, I doubt that there is already.
Susie, if you want to respond, feel free, but I think Susie is no longer here. Any other questions there, Christian?
Any other question from the room? maybe one from my side. I like that you mentioned the younger population, teenagers and kids listening to the radio and the special programs, and basically the communication of information they are provided with. And I think that's quite interesting, because sometimes we probably forget that we as adults often didn't receive such information 20 or 40 years ago.
Absolutely.
And so I think we should see it as an opportunity for the younger population to educate them in that, because that will be the generation that will need to solve the problems that we leave them in 20 years later. And I think that's quite an opportunity we can take, and we can learn how best to educate the young in other issues, but critical health literacy, so they don't repeat the same mistakes that we did.
Yeah, that's a great. I mean, thanks for the comment. I think that makes absolutely sense. And again, I mean, I feel caught because I haven't thought about it. That's right. They grow up differently in terms of learning experiences so differently, and we need to take advantage, just as you say. Excellent.
So any other question here from the room or online, Oscar?
Online, I only reading praise for Thomas, that it was fantastic, excellent presentation, lots of food for thought, and yeah, thanks from everyone, and thanks from my side, Thomas. Thomas, maybe I ask you a question. Do we really need to specify the P for pandemics, because we live in a constant pandemic of cardiovascular disease, obesity, etc., that also need urgent decisions and critical actions, also planetary health, climate change, etc.
That's a good point. I mean, the concept evolved from health promotion, and the only epidemics they were dealing with was obesity epidemic. So I think it's very different, the current pandemic, from a virus, a deadly virus, from such things as obesity. I think somehow, but you are the expert. I think we have to think about this. But I naively thought that, well, in obesity we have more time, and in obesity we basically know what to do. And both of these do not apply to the current pandemics. We have absolutely no time, and we really don't know exactly what to do. We know a few things, but we haven't understood the causality of all of this. So this is why I thought the P is needed. But I may be convinced that it's not.
If your first slide was, in pandemics, we need the people to think. I don't see how in the pandemic of climate change, obesity, cardiovascular disease, we don't need people to think.
Very good point. Great, that makes a great finish of that talk, because you go back to the first slide and you open up new challenges, new questions. Absolutely, I couldn't agree more. I have to think more about it. Yeah.
Thanks a lot, Thomas, and thanks everyone for joining online. Christian, you have the final word, please.
Thanks, Oscar. Thanks, Thomas, for this excellent talk, and the audience online and here for very interesting discussion, and maybe a final applause.
Yes. Okay.
Everyone.
Thanks. Bye-bye.
Thank you so much for coming. This is so important, and I hope you also thought this is food for thought. I mean, nothing is definite today. Nothing is definite. It's just trying to open a new perspective, and I hope more comes out of it. Thank you. You too. So, you didn't ask a question.
Well, I have a question.
Okay.
That maybe you could listen because I think one of the origins of the I'll wait for Christian.
Oscar?
Yes, I'm here. Hi, Amoya.
Hello. Would you like to talk with everyone, or can I end the meeting?
No, please, I need to talk to you for a second. We have issues with the sound from the audience. We don't hear the questions when we are online. So maybe we need to try to find a way of put an additional microphone closer to the public, or have a portable microphone. Since it is 10 or 15 people, they could just pass the microphone to another person when they have a question. But it's very difficult to hear the questions of the public for those that are online. So maybe just having a microphone, a portable microphone, something small that the one who is hosting can pass it to the person that has a question. Then we can all hear it. That would be fantastic.
Okay, yes, I will check with the IT for the next time.
Thanks, Amoya. And for the rest, I wanted to say hi to Thomas and Christian, but I've seen them. So give them my regards and thanks. I know they're entertained now. Thanks, Christian. Thanks a lot.
Thanks.
It went very well. So thank you. And please give my thanks to Thomas. It was very interesting, the seminar.
Thanks, Oscar.
Tell him that there was a lot of messages saying thank you to him and saying that there was a fantastic lecture. Thanks. Okay. See you, Amoya. Thank you.
See you. Bye.
Bye.
Yeah, that's a good question. So I'm reading the Chile and the paper in January, which was basically highlighting the risk of, and then